want to welcome everybody. I want to welcome everybody to the Dana Lecture. The Dana Lecture was created at a Department of Psychiatry retreat many years ago. At that retreat, the recommendation was made to institute a visiting African-American professorship in psychiatry so that outstanding experts could be invited to lead educational discussions for us. And so I'm very pleased to introduce Dr. Andrea Watkins. She has coined the culinary psychiatrist and is a nationally recognized physician with a specific focus in the practice of nutritional psychiatry. She's a two-time recipient of the Top Doc Award in the field of psychiatry and named MSN's Top 10 Self-Made Women of 2025. She's board certified in both psychiatry and neurology. She's been practicing in the field of medicine for over 15 years. Dr. Watkins is the owner and CEO of Freedom Mind Wellcare and Consulting, LLC. She's a native of North Carolina who moved to the DMV area for residency training here at the University of Maryland, Sheppard Pratt. Following residency, she further diversified her experience by working within a range of treatment settings across the recovery continuum, leveraging her experiential knowledge of community-based participatory research as her focus during her master's program. Dr. Watkins has provided consultation services and served as an advisor in both public and private sectors to advance the quality of mental health services provided to the public and closing gaps in access to care. She's a thought leader in the field of quality improvement and has held several leadership positions to advance the growth of behavioral health programs. So with that, we're very pleased to have Dr. Watkins with us today to talk about nutritional psychiatry.
Thank you, Dr. Forrester. Can you all hear me okay? No. Maybe is that better? Slightly. Better? Okay, perfect. Good morning, everyone. I'm Dr. Andrea Watkins. I'm excited to be back to my old stomping grounds. I trained here in 2013 and see some familiar faces out here. So I'm excited to be able to come back and serve and to be able to share in this experience. So thank you, Dr. Forrester, for the introduction and for the opportunity to speak today. As you mentioned, I am a nutritional psychiatrist, and I'm here to talk about a very important topic that I hope will be making a wave and a movement in the field of psychiatry. And the name of my talk is Nutritional Psychiatry. I have a gut feeling, an integrated approach to the treatment of psychiatric disorders. And I think it's important, especially for today, to acknowledge food can be an opportunity for collective healing. So disclosure, this information is for informational purposes. The views and opinions expressed in this presentation are those of the presenter on behalf of Freedom Mind Wellcare and Consulting. There are no financial disclosure or conflicts of interest with the materials of this presentation. The learning objectives for this talk, I would like to define the practice of nutritional psychiatry and the influence of the gut-brain axis on mental health disorders. I would also like to define how nutritional psychiatry treatment approaches can mitigate symptoms of psychiatric disorders. And describe the role of cultural sensitivity as a tool to leverage the treatment impact of nutritional psychiatry within the community. So what is nutritional psychiatry? People have different definitions of this. One of our major thought leaders in this field is Drew Ramsey. He describes nutritional psychiatry as the use of nutrition to optimize brain health and to treat and prevent mental health conditions. I like to further define it as explores how food, nutrition, and digestive health impacts cognition, neurological functioning, and the presentation of psychiatric disorders. This is not new. So think about Hippocrates. He said, let food be thy medicine and medicine be thy food. We are what we eat, and how we nourish ourselves impacts the modulation of the body's homeostatic processes. We know that poor nutrition increases our risk for a host of chronic conditions, We're very familiar with how what we eat impacts heart disease, obesity, and diabetes. And we are learning even more so about the impact of how we eat and nutrition on depression, dementia, cognitive disorders, and other psychiatric symptoms. Other ways are supporting evidence of how we understand nutrition and its impact on mental health, right? So we're all familiar with the vitamin B12 deficiency. It can cause pseudodementia, lethargy, depression, poor memory, and has been associated with symptoms similar of mania and psychosis. Vitamin B1 or thiamine deficiency, very commonly associated with beriberi. We notice that it has a lot of central nervous system manifestations and also can be can lead to Wernicke's encephalopathy. Vitamin B9 or folic acid deficiency, we've known for quite some time that it has an impact or detrimental effects on neurodevelopment in utero and in infancy, and can also be one of the leading causes of depression in adulthood. Niacin or vitamin B3 has been noted to have a deficiency can cause pellagra or dementia. So these are all very known, scientifically proven nutritional deficiencies that we're very familiar with. So let's talk about some of the common ways that vitamins can play a role in our immune function and also in just the way that our body operates overall. So vitamin E is an antioxidant that plays an important role in our immune system. It also helps to maintain cell membrane integrity and epithelial barriers by enhancing antibody production, lymphocyte proliferation, and also natural killer activity. Vitamin D is very important. It lowers our viral replication rates. It can suppress inflammation and also can increase levels of T regulatory cells and their activity. Vitamin C helps to maintain epithelial integrity. It enhances the differentiation and proliferation of B cells and T cells, and also can enhance phagocytosis, normalize cytokine production, and can increase histamine levels. Vitamin A, a very common vitamin, is also involved in the maturation of CD4 T cells, the function of B cells, and the regulation of inflammatory cytokines. Or in historical context, how we have eaten has evolved, right? So almost 99% of the human history, we were hunters and gatherers, right? We had a very mobile lifestyle, and our consumption behaviors are very much to meet the needs of the way that we moved. And it prevented the occurrence of what we will call more of the chronic non-communicable diseases. What also was very important was our consumption of the ratio of omega-6 and omega-3 fatty acids. Over 99% of the time throughout human history, there was essentially a 1-to-1 ratio. And what we'll talk about later on is how that has changed as food has changed. Now we have the American diet. It has changed radically since 1800, right? So due to industrialization, technological advances, and really just the need for food to be accessible and quick, right? So foods have become progressively more processed. And there is not a causal, but there is a parallel relationship between delayed rise and non-communicable diseases in the United States and the change in the American diet. When you look at the changes in the composition of the American diet from 1970 to 2010, we have noticed an increase in the amount of added fats and oils and dairy fats, a 66% increase, right? And also a 42% increase in the availability of flour and cereals. In addition, I thought this is really important to think about the amount of added sugars and sweeteners. There was an overall 10% increase in that, with a very small increase in meat, eggs, and nuts, 3%, where we've seen an overall loss of dairy and vegetables, right? This is sugar. So the estimated total caloric sweetener has increased dramatically, 206% from 1875 to 2019. And this is when you adjust it for overall total caloric sweetener availability. Overall has increased by 4%. High fructose corn syrup has increased by approximately 3,570% in our food. I think that's very important as we talk overall, moving forward about how overall impact of what we eat and the composition of our food impacts mental health. We've also had dramatic increases in processed foods. So ingredients in our processed foods have changed. We're having more canned or bottled vegetables. We're having more smoked meats and also more ultra processed products such as chips, pretzels, ice cream, kind of the foods everybody likes to eat, right? The fast food things that taste delicious. And this kind of is what correlates with what I was talking about earlier about our omega-6 and omega-3 fatty acid ratio. So what we're seeing is we're seeing an increase in the composition of omega-6 fatty acids in our food in comparison to the composition of omega-3 fatty acids. This is creating a pro-inflammatory environment in our body, right? We'll talk a little bit more about how the inflammation impacts the presentation of mental health symptoms. So yes, we are now aware that there's a growing body of scientific evidence that inflammation can be correlated with neurological diseases, multiple sclerosis, Alzheimer's, depression, and schizophrenia. From a laboratory standpoint, we see that high glycemic index diets are associated with elevated C-reactive protein. High refined carb and factory fats are associated with higher levels of C-reactive protein. There's a Belgian study that found an association between major depressive disorder and the activation of an inflammatory response system. So several factors, including diet, plays a role in our risk for mental health disorders. I want to again underscore omega-6 consumption dominates the Western diet 10 to 25 times more than our ancestors. So let's talk about the gut. We all know what the gut does, right? So the role of the gut is to digest and also to absorb nutrients. I think it's also important to talk about the protection of the gut. It can be I think, a more complicated body system than we give it credit for. It also protects against invaders such as bacteria, viruses, and parasites. It influences the immune system's response. It moderates biology and chemicals for the brain. It helps to manage stress and also does help to control our inflammatory pathways. In the gut is where we have our enteric nervous system. It's developed from the same tissue of our central nervous system, and that's where you find our vagus nerve, which we call our wanderer. It wanders throughout the digestive system, and many people call the gut or nervous system our second brain. 80 to 90% of serotonin is actually found in the gut. The gut is also very much responsible for our immune system. So we have our gut-associated lymphatic tissue, which actually represents 70 to 80% of our total immune system. It moderates the inflammatory response pathways in response to stress and foreign pathways. And then our microbiome. This is where we're continually learning and growing about these tiny bacteria that grow in our gut that do a lot more than we thought we knew that it does. So there's many different strains with unique effects. 90% of the bacteria that are comprised in our gut are in two different classes. We call them the Firmicutes, which can be coined as the fat-loving, or the Bacteroides. I think it's interesting that you can find the ratio between Firmicutes and Bacteroides are related to a risk for chronic illness. And also, you can also even maybe be able to predict someone's risk for chronic illness by looking at the ratio between Firmicutes and Bacteroides. And two most studied strains that we commonly look at in science are Lactobacillus and Bifidobacterium. So the gut, the brain, and the microbiota axis. This is a pretty complex communication system, right? So we have direct neural signaling between the vagus nerve and the spinal nerves as a primary messenger in response to stress. And this stress can look many different ways. It can be physical stress. It can be psychological stress. Our body doesn't really know the difference, right? So whether or not you are stressed about a test or exam, or you're nervous because there's a physical threat, either way, the nervous system is sending a response to the gut, and there's this back and forth communication pathways to help mitigate how our body responds to stress and to keep homeostasis within the body. It activates adrenaline and immune responses. We know that chronic activation of this of stress can lead to chronic disease. There are also hormones circulating in the blood, neurotransmitters and neuroactive mediators, which are produced by the gut. So we have these microbiota that not only are helping to moderate and influence the signaling that happens between our nervous system and our brain, but they also are producing neurotransmitters. So Lactobacillus and Bifidobacterium species are known to produce GABA. There are other bacterial species that can produce norepinephrine. Candida, Streptococcus, and other species can produce serotonin, and a host of other bacteria, dopamine, and good bacteria known to produce BDNF. BDNF is a really important neurotransmitter. It's really involved in neurogenesis. And so being able to think about the composition of your microbiota can really directly reflect the ability for your body to respond to stress based upon the neurotransmitter availability within your body. We also talk about how the gut-brain microbiota system impacts the immune system. So immune cells, cytokine secretion by immune cells have effects both locally in the gut and on the brain function, acting like a fire alarm that activates when something is wrong. So the gut bacteria can send signals to the immune system and can interact with the immune and the endocrine system. So they can trigger the autoimmune response. They can help to moderate cortisol and adrenaline levels and also kind of mitigate between chronic immune response. We know that ongoing chronic immune response can be correlated with autoimmune disease. So what happens? So we know that microbiota are extremely important, and the composition of the gut can help is much so associated with our health, right? So what happens where there's an imbalance in the gut? This we call dysbiosis, and we'll talk a little bit about what that looks like and how that contributes to the presentation of mental health symptoms. What can cause imbalance in the gut? Stress. This is a huge one. Introduction to toxins, so external environmental toxins, infections, antibiotics, poor nutrition. There's a bidirectional relationship, right? You know, what you eat can impact the composition of the bacteria in your gut and vice versa. And also there's a genetic predisposition, which I'll talk a little bit more about later. So one of the main things that we can do to impact the composition of our gut is really what we eat, right? That's one objective tool. So what we eat informs the integrity of our gut. It's kind of like survival of the fittest. So depending on what you eat, that will kind of drive what type of bacteria are living in your gut. If you're eating lots of, fast foods, then you're going to have a gut that's comprised of bacteria that love those foods, right? You're feeding that. If you have a more diverse or traditional diet, you're going to end up having a more diverse composition of bacteria within your gut. This is related to your risk for mental health disorders. So I thought it was important to talk about how dysbiosis and imbalance of the gut and how we have seen in the past scientific studies that have looked at how reintroducing healthy bacteria can reduce your risk for psychiatric disorders. So probiotics reduce the risk of rehospitalization and bipolar affective disorder. This is actually a study done at Shepherd Pratt. And then a reversal of acute anxiety has been seen in mice studies by introducing lactobacillus or B. longum within the diet. Microorganisms can actually be passed through the vaginal birth canal as well. So we talk about what is your risk factors for the composition of your gut. Think about what we now call a set point or inflammation. So it can shape your risk for chronic diseases. ADHD, autism, dementia, we don't really know, but we're looking at correlative studies about whether or not you had a predisposition for these diseases based upon what type of microbiota you obtained from your mother or did not obtain from your mother during vaginal delivery. So let's talk about a difference between the Western diet versus the traditional diet, right? So Western diets are low in fiber. It favors bad bacteria, inflammation, and increases your risk for depression. It's also associated with mood disorders. More traditional diets, the most common that we see in scientific studies are the Mediterranean diet, or more rich in fiber, low in processed foods, and noted to be associated with decreased risk of depression and protective against dementia. So some intervention strategies, right? So from the nutritional psychiatry perspective, what is the way when you see a patient where you can make some direct impact to mitigate some symptoms of psychiatric disorders? And how would you really address someone who came into your office? What would be your treatment approach, right? So first you would look at mood management. You would do therapy and behavioral modification. You would do nutrition and also stress management. So what's a holistic approach? I think oftentimes people can get really nervous when they think about nutritional psychiatry because because the way that science is, we really want something that's very concrete. And we're still learning more about, there's still a growing body of evidence about exactly how nutrition impacts mental health disorders and what be a specific treatment algorithm. But I think what is important to note is there's no difference between their approach with the nutritional psychiatry and other more traditional approaches to psychiatric management, right? So you would still do mood management, you would still do therapy and behavior modification, you would add nutrition as an adjunctive treatment, and you really work on stress management, just because we talked about how stress can really impact the composition of the gut. So I wanted to go through just a catalog of what the growing body of science talks about in regards to what are some more diet nutrition modifications based upon disease states. So for depression, most of the body of evidence talks about the Mediterranean or traditional dietary pattern, or seafood omega-3s, B vitamins, more plants, microbiome or fermented foods, and limiting high processed foods, as well as adding probiotics. This can be a treatment approach for those being treated for a major depressive disorder. Anxiety disorders. There's a growing body of evidence about the relationship between choline, which you can find in eggs, and reduction in anxiety symptoms. So for someone coming in to be treated for anxiety, you may recommend, increasing the amount of choline in their diet. You also may recommend increasing the amount of omega-3 fatty acids. Probiotics seems to be consistent across most of psychiatric disorders, increasing the amount of increasing probiotics, adding them into your diet. And also, there's some growing body evidence around gluten sensitivity and maybe removing gluten from your diet to reduce symptoms of anxiety. Also, reducing caffeine based upon a person's sensitivity to caffeine. There's also relationship between sugar spikes and anxiety. So one of the things that you could talk about was, whether or not how a person consumes their food, their day of time they consume their food, and also the composition of sugar in their diet. Increased consumption of Western foods and a more modern dietary pattern definitely correlates with the elevated risk of anxiety disorder by 25 to 29%. ADHD, most of the evidence towards ADHD is increasing whole foods and actually more of a reduction diet. So reducing sugar and additives, adding in probiotics and omega-3 fatty acids, and just really kind of having a whole food, less processed diet. Bipolar disorder. Most of the evidence for bipolar disorder is really around omega-3 fatty acids, probiotics, ketogenic diets, which is a really growing body of evidence, reducing inflammation through reduction of nitrate-free foods. There's been association between nitrate-containing foods and manic episodes, and also lifestyle modification. So this is something that I just kind of pinpointed or talked about earlier, was around the fact that you're born with it, right? So I think this is really interesting. And I think I'll talk a little bit more about this later, but it underscores the role of the gut and microbiota in how we see epigenetics, right? So you can get exposure to microbes are actually through utero. So you think about whether there's a vaginal versus a C-section, and also other ways that you can get exposed to bacteria that helps to influence your gut is through breastfeeding. We do know that exposure to antibiotics in utero can do harm to your gut. So when you look around, correlation between risk factors for those who go on to have psychiatric disorders, particularly ADHD and other ADHD, depression, there has been a relationship between whether or not there's exposure to antibiotics. The theory is really around inflammation and goes back to what we talked about earlier about the inflammatory set point. Other intervention strategies, psychotherapy, early attachment styles, which is my favorite, pattern of eating, coping skills, triggers, drama, and food diary. And so I'll talk a little bit more about why early attachment styles are important, but I did mention earlier in my talk around how your body sees stress. So whether or not you were running away from a dog or you have maybe some acute stress about, I don't know, taking a test or exam, then whether or not there's chronic stress. So early attachment styles, right, have been known to have an impact on inflammation through to how your body sees stress. Right. So how you attach to your mother, how you attach to your early caregivers can over time not only change your body's response to stress, immune system modulation, inflammation, but also the composition of your gut. That directly correlates to your risk factors for psychiatric disorders, a host of them. Of course, there's other factors, right? There's genetic risk factors. There's biopsychosocial factors such as additional ongoing stress, nature versus nurture. But I think this is important to understand. Oftentimes, this could be a missing link to whole healing versus symptom management. So we would do holistic care, as I mentioned, medication management. You would talk to your patients about side effects. You would also want to bring other specialists involved. You would want to talk with their primary care physician, talk about their lifestyle, self-care, and somatic movement. Particularly somatic movement is really helpful for nervous system regulation. So as I talked about this three-pronged approach, right? You have your nervous system, you have your gut, and you have your microbiota, right? So oftentimes, people may take a medication and they will say, oh, it's not working. But also, what is going on with your stress? How is your nervous system being regulated? Even if you eat very healthy, if you still have a what I will call almost like a stressful environment within your body, it will limit your response to treatment. So somatic movement has been a growing, there's growing body of evidence about somatic movement and nervous system regulation. That can be another very impactful tool to add into how you can not just treat psychiatric disorders, but also just incorporate overall, if it allows the person to feel in control of their care, right? So it's empowerment as well. So foods that you want to eat the rainbow, right? So here you have I have just a picture of a rainbow of plant-based diets. Although, we do know that protein is very much important. So this picture is not all conclusive of what a healthy diet will look like. I just put this here because I want people to understand that the more diversity you have in the amount of food that you eat, the more likely you are to have a healthy microbiome system to create an environment that's healthy for mental health. I wanted to go through some key nutrients that are important that you might want to address with your patients, and what could be deficiencies that you might want to talk with them about to incorporate in their treatment plan. So vitamin E, its role is to function in the brain is to protect the neuron brains. It's involved in vascular health and also decreases inflammation. It's linked to depression and Alzheimer's disease. So some top food sources where you can find vitamin E would be in almonds, olive oil, avocados, sunflower seeds, peppers, and tomatoes. Iron is extremely important, and I think we underscore it in our psychiatric practice oftentimes. But its function in the brain is to transport oxygen to the brain, so we need that, right? It also is important for neurotransmitter synthesis, dopamine, norepinephrine, and serotonin, and is essential for brain development. I think it's fascinating that 10 to 15% of women between 18 and 40 are considered to be iron deficient. And they say it's irreversible. And I will say, because I do think there's opportunities for that to be reversible based on how you modulate your diet and reduce inflammation within your body. Some of the top 5 food sources for iron is grass-fed beef and lamb, beans, spinach, pumpkin seeds, and chocolate. Vitamin A is also a strong anti-inflammatory nutrient. It's involved in immune health, DHA production, which is important, and also antioxidant brain protection. Top food sources for vitamin A include carrots, pumpkins, mustard greens, sweet potato, and chicken liver. Vitamin B12 can function in your brain for cognition, mood, inflammation, brain integrity. So we can't talk enough about B12. You find this mostly in your animal products, eggs, meat, seafood, and dairy. So if you're treating a patient with vitamin B12 deficiency, you want to make sure they're getting enough of protein sources. This can definitely be an issue for people who are vegans. So you want to make sure they're finding alternative sources for B12 or maybe even supplementing. Zinc. So zinc is very important in our immune function, also protects against infections and inflammation, and is associated with postpartum depression. So, food sources for zinc can be steak, oysters, ground turkey, sesame seeds, and pumpkin seeds. Magnesium, also associated with depressive disorders, but is essential to vitamin D synthesis. So I also think that's important too, because we think about, sometimes we think about vitamins in isolation, but one impacts the other, right? So I think it's important to think about that as well. So some of the top food sources for magnesium is pumpkin seed, spinach, Swiss chard, beans, cashews. Omega-3 fatty acids, this is one of the most important supplements I could think of. So remember, if you remembered earlier in my talk, we talked about different psychiatric disorders. Omega-3s were consistent across all of them. And so when you think about the importance of omega-3s, they're important for neuroprotection. They are important for protection against psychosis, depression, dementia, and also to reduce inflammation. So some of the top food sources for omega-3 fatty acids include almonds, salmon, sardines, oysters, walnuts, flax seeds, and chia seeds. So I want to talk a little bit about cultural sensitivity. Nutritional psychiatry is something where everybody can be involved in it. But I also think it's important to underscore that nutrition is not consistent across the board for everyone, right? You know, there are food deserts, there's cultural components to how we see food, and then there's a communal way that we see food. For many people, food is healing just because it's sitting around the table, and eating can be something that increases socialization, making a meal, interpersonal relationships, and things like that. So how do we use cultural sensitivity in our approach to nutritional psychiatry? And in the field of mental health, how do we operate in a way that cultural sensitivity is the top of our mind, right? So there's health disparities, there's psychosocial stressors and cultural experience. And then again, food is a culture. And how do we provide culturally responsive care? Diet is really based upon your culture. So when you're treating your patient, you need to keep these things in mind. So when we talk about health disparities, I wanted to talk about trauma. So in the Black community, 20% or more of individuals in the Black community are more likely to experience mental health symptoms. Black adults ages 15 between for Black adults ages 15 to 25, and 40% are homeless population, 50% of the prison population, and 45% of the children in foster care are African American. Impacts of health disparities are related to racism, social injustice, the cultural experience, and then dates back to slavery. How does this connect, right? So I wanted to talk a little bit around access, intergenerational trauma, stigma, shame, and limited cultural responsive care. So a 2021 study said that 21% of Black and African Americans who had a mental health concern, only 39% of them had access to mental health services. The suicide rates of people of color continue to increase, and Black Americans are facing a 58% increase in suicide rates between 2011 and 2021. Suicide is the third leading cause of death for Black and African Americans, Black or African Americans between the ages of 15 to 24 in 2020. Intergenerational trauma, and how does this relate to what I'm talking about today, right? So I gave a little bit of, I talked already about how the microbiome can be passed between your mother, right, through vaginal delivery. But I also think it's important to talk about how trauma can impact the gut and how that can be directly related to psychiatric manifestations. So the microbiome can be looked as a unique perspective on epigenetics. Maternal ACEs can impact offspring and their impact on offspring, right? So there's studies looking at the impact of maternal adverse childhood events, right, and behavioral dysregulation, negative emotionality, internalizing, externalizing symptoms, and physiological correlates of their offspring. Noted to see increased cortisol, inflammatory cytokines, HPA axis functioning, epigenetic functioning, directly correlated to the maternal ACEs score. So there's a correlation between PTSD and certain bacteria. And the Human Microbiome Project saw that racial ethnic background was a predictor of the gut microbiome composition. A study by McKenna et al. Showed that maternal adverse childhood experiences were associated with increased symptoms of psychopathology in her offspring, and that there's a relative abundance of bifidobacterium, lactobacillus, and prevotella during infancy during symptomatology during toddlerhood. There's a greater abundance of lactobacillus may buffer the intergenerational impact of maternal ACEs, but the evidence was limited. So what does this really mean, right? So when we talk about intergenerational trauma and we talk about epigenetics, how much of this is also comprised in our gut? So I talked a little bit earlier about how mice studies can show that when a mice is separated from their mother, that it changes the internal gut flora. And you can change the psychological symptoms by reinstituting lactobacillus or other healthy bacteria. You saw a reduction in anxiety. I think about it almost like attachment, right? I think about what does this look like from an intergenerational trauma perspective? As we talk about how microbiome gets transported, from mother to child, but also just nature versus nurture. So if a mother has a traumatic experience, how likely is she able to, how more likely is she to transport that how likely is she to impact her offspring's risk for trauma as well? And when I say trauma, not that the child witnessed trauma, but what does the body feel the trauma from an epigenetic or from an epigenetic perspective? So, how can we use this information to close gaps in care? Maybe food is an alternative treatment to more historically methods of treatment. So there's stigma, there's shame, there's culturally responsive care, and then there's limited access in many areas. So maybe food can serve as an in for many other individuals who may be less likely to be open to more traditional methods of treatment. So maybe doing nutritional changes can be a way to serve the community in a more public health perspective. And so I think food can have a very important way of closing gaps in care as an alternative, more stigmatizing care. This study, a rodent study, found that association between early life stress and development of stress-related symptoms was reduced in rats when they ingested a probiotic containing lactobacillus. So when you think about it, maybe if someone is not open to receiving psychotherapy, or maybe they're not open to medication management, maybe the end for them for treatment could be nutritional changes. And maybe they can even have a more global population health management impact, right? Especially for communities of color where there's less access and less openness and more fear of the medical system. So health equity. So I talked earlier about this. So how do we remove barriers? There's things, food insecurity, there's socioeconomic status, there's food deserts, and then we say health as well. There's psychosocial stressors. So what are ways that we can think about it from a population health perspective to increase access and also to mitigate some of the risk factors for the underserved population? How can we create community impact programs where we don't have to do it on an individualized basis, but maybe there's community programs where we can enhance the experience of underserved through access to food, reducing the processed foods that they are more likely to eat, having more culturally sensitive care by having conversations around their experience with food. I mean, just kind of opening up the dialogue. I think sometimes food is easier to talk about than depression, right? And so what does this look like from a population health management standpoint? And how can we use this as a way to remove barriers, increase access to care on a larger scale? So I just wanted to close this talk by saying food is a culture, and healing can begin at the table. It seems very overly simplified in a way, but I also think it's very powerful as we continue to look at it from a prospective way about how we can continue to impact mental health symptoms from a nutritional standpoint. I think thinking about it, about adding cultural sensitivity to the table, and thinking about it how food, culture, and just interpersonal relationships about what it looks like to cook together and bring communities together can be a very essential way for closing gaps in care and treating mental health symptoms as well. This is really just a slide to just kind of conclude everything I've talked about today. So nutritional psychiatry, we talked about the gut, we talked about the nervous system, we talked about the microbiota, but this symbol really just kind of shows everything that's kind of contributes to it. So in the center, you have chronic stress, right? Dysbiosis, inflammation, immune dysregulation, and mental health, they all kind of work together. So if you're kind of thinking about it from these multi-pronged approaches, which way can you kind of find your in? I think nutrition is a really important way to do that. So my motto is always eat yourself to mental health, and thank you.
We do have time. Oh, we do have time for questions if there's any questions from the audience. And then we're also going to check on the Zoom if there's any questions. I see a question here in the back.
Thanks for the talk. I was wondering what your thoughts are on the new CDC kind of food pyramid. It seems like it's very consistent with nutritional psychiatry goals, but there's a lot of criticism that it may be informed by industry, but it doesn't seem necessarily the case. Just wondering what your thoughts were.
My main thoughts around that is that it highlights the reduction of processed foods, and then increasing the diversity of the amount of fruits and vegetables that you eat and reducing the amount of omega-6 oils. So to me, that's important. I've not always felt that the nutritional recommendations or guidelines that are recommended in the Western diet correlate with nutritional psychiatry, right? So it's almost like it's playing catch up. Everything I've talked about today would not have fallen in line with the recommended diet recommendations according to even up to now, right? So from a nutritional psychiatry perspective, I think we're always ahead of the game. And I think there's always been what's the word? There's a culture around what we think is healthy versus what is not. And I think what we're doing is unpacking and kind of almost getting back to what we know was healthy and what was correct and what was right. So I think we're moving towards the right direction. I always think you follow science versus the culture, if that makes sense. So what I would do and guide in my practice will be around what we know about what's most important for the brain, what supports microbiome diversity, and what we know around inflammation and chronic disease. And I would recommend anybody who wants to do the focus on nutritional psychiatry that should be their approach rather than some of the recommendations that may come out for the Western diet.
Yeah, thank you for today's talk. I know like every single one of my outpatients are asking about this kind of information, so it's very relevant. I'm wondering about supplements. There's a lot of supplements out there, and I feel like they're very much on, the algorithms and they're in a lot of people's faces. One question is like, do you see a difference in supplements versus the actual foods, either from like a psychological perspective or the actual nutrition? And then also maybe how do you talk to patients about supplements?
That's a great question. And my answer would be yes and no. So, ideally you want to get all of your nutrients from your diet. But of course, that's not always the case. There's several different reasons why that may not be possible. And then, of course, there's genetic risk factors where even if you do eat a very, diverse diet, then maybe your body's not able to process or absorb all the nutrients. So supplements can be a very valuable adjunct, right, to the diet. I do think that there's this culture where what we do in regards to food and supplements can be non-factual and it can be scary. A lot of times there's a lot of misinformation, and I get it too around, if I take this supplement, then my brain is going to change, or this is going to be a heal-all. And I think that can be scary. I think having a very realistic conversation with your patients around, number one, their body. That's the thing about nutritional psychiatry is very individualized. There are definitely more generalized approaches that you can take, but everything is one-to-one kind of. So you want to have a conversation with your patient about what they're eating. Laboratory values are very important because a supplement that's not necessary can be harmful, right? And then you want to figure out what are the true deficiencies. So really you're treating based upon their particular nutrient needs, and I think that's very important.
Hi. That was loud. I was wondering if you could talk about the kind of the level of nutrition instruction and training in medical school and residency, or the lack thereof, and then maybe how much training and instruction you received at each level, and maybe how you think that needs to change, or what you would do to change that so we could stop playing catch up.
It kind of dates me a little bit, right? So I trained, what was it, 10, 12 years ago? I think it's getting better. I actually just participated in the panel where they're creating a nutritional food as medicine program at University of Kentucky. I mean, I do know that there's food as medicine programs are growing, and it's not just in psychiatry, it's across the board. And the way that we're looking at nutrition is being incorporated in all disciplines. So I'm hopeful. I feel like where we are today is the movement that we should be taking. I think you can, definitely engage in whatever nutritional science programs that are in your residency program, but I also do encourage people to not be afraid to learn on their own. A lot of what I did, if I look back, it actually started when I was in residency training, to be honest. So I was working in a trauma trained clinic, and a lot of my patients were on atypical antipsychotics, and their diets needed to change. And what I noticed experientially was, as diet changes were made, in addition to compliance of the medications, there was real impact. So don't be it. I think I would encourage people to be empowered to do it now. And to be empowered to be in control of your own learning and science. There's lots of data out there, and there's lots of scientific articles. And what I feel hopeful about is that a lot of the literature and the work and trials were done in the European countries, but now we're starting to see them in the United States. So in the US, we're catching up, but I now feel like we're moving in the right direction.
A question in the chat, if you that one out.
There's been a recent controversy around seed oils due to the ratio of omega-3 to omega-6. However, there are many countries that culturally focus on seed oils and/or avocado oils might not be available. How does one approach this new information around seed oils? So I think there's always going to be controversy around what's right and what's wrong. I think you need to stay founded in the data. It's really around omega-3 and omega-6 ratio. So regardless of where the omega-3 or the omega-6 fatty acid, the source of it, it really is around the ratio and the composition of the diet. So I really would approach it around, if it really doesn't matter where you're getting your omega-3s from, as long as it's a healthy source, right? And as long as you're making sure that it's in the proper ratio with omega-6s. The scientific evidence is really around the ratio. So what you really want to do with your patients is just ensure that there's a balance. So omega-3 and omega-6s need to be in a 1-to-1 ratio. So I hope that answers your question.
So much for talking with us. You gave us a lot to think about in terms of the vitamins and nutrients that impact all different domains of mental health. And I'm wondering, for somebody who might live in a food desert or not have the financial means to chase after all these different nutrients in the foods, in your experience, have you found any low-hanging fruit, so to speak, in terms of simple changes to somebody who's on a very Western diet that could have the biggest impact on their mental health?
Absolutely. I think it really is just around so if you can't get the best, then I think the main thing is just think around diversity, right? So even if someone is eating a canned fruit or vegetable, is better than, potato chips, right? So I really just try to have conversations around access and how to just really change adding things into the diet that are helpful versus restriction, and understand that food deserts are a real thing. So having conversations around, can you find broccoli, or how many green things can you find to be incorporated into your diet? How many things from the supermarket that you can find that can be there don't require fruits and vegetables don't require to be cooked is another option. And then other things can be talking about, like just switching out certain things. So maybe you can't afford fresh salmon, but maybe you can get canned salmon, right? It's better than, I don't know, Hamburger Helper or something like that. So it's really just around meeting the person where they are and encouraging them, because there can also be a lot of shame around that as well. So I really just like to open up the conversation around what you can add versus restriction, because I think when you talk about restriction and kind of talk about what you're doing wrong, people really also oftentimes want to step away, and then it really closes off the therapeutic relationship. So, where can you look when you go to the grocery store? Look around. You can play a game even with the kids, and get the entire family involved. What can you find? How many colorful vegetables can you find? Can you add in? And then it becomes almost like positive reinforcement. And I find that people get to continue to grow in that avenue.
Thank you for your talk. Probiotics come up a good amount in the talk, and it's a little bit related to supplements, but I sometimes struggle recommending them because they aren't regulated. And so I'll often recommend prebiotic foods. But do you recommend probiotics, and are there any that you recommend in particular, or is it the similar kind of what you were talking about of leaning into the foods the fiber that feeds the gut biome and things like that?
So it depends on the person, and it depends on the disease state. Some people really do need probiotics, meaning that there has been a depletion in the bacteria that are healthy that can help to move forward to a healthy state. And so I do think that probiotics has a valuable place. for reasons that we don't fully understand. Some people's microbiome has just evolved and changed and requires repletion. So I do think there's a role for probiotics. Prebiotics are also just very much important because as I talked about, you got to feed the bacteria that you put in there, right? So if you're taking a probiotic supplement but you're not eating a healthy, diverse environment, they're going to die off. Probiotics vary across the industrial system. You're absolutely right. I don't have a favorite brand because it's also around access. What can you afford? I think sometimes there's markets for very expensive probiotics that I don't think are any better than some of the less expensive ones, but live probiotics are important. And I think diversity of strain are the main two things that you want to focus on. Yeah.
Can I ask a question from the Zoom audience?
Yes.
First I want to compliment the speaker on providing information on a topic that I certainly got no information about it throughout training or subsequently. So I appreciate that. I have gotten introduced to it a little bit recently because one of our own faculty, Dr. Deanna Kelly, who is out of town this week, so she probably is not here, is doing work on ketogenic diets for psychosis. So I wonder if you could more broadly address the issue of any research on specific diets to address specific psychiatric conditions.
Yes, Dr. Kelly is like a hero. So I actually participated in one of her recent studies just to understand more around the ketogenic diet. I don't do it in my practice, but there's a lot of evidence around the use of ketogenic diets and the reduction of bipolar symptoms and schizophrenia. So it's a viable approach, I think, to the treatment of a host of psychiatric disorders, psychosis and bipolar disorder. And I think really what it comes down to is how do we feel comfortable with it? Approaching a ketogenic diet can be very scary because, there's medical complications due to it if you don't feel comfortable and you're not doing the right laboratory follow-up. But I do think that there is growing body of evidence and there's lots of scientific studies that do support the use of a ketogenic diet in reduction of bipolar disorder symptoms and in schizophrenia. So kudos to Dr. Kelly for all the work that she's doing and all that she's doing to, inform providers like me who are learning more about it so that it can be something that I can incorporate in my practice as well.
All right. So with that, we want to thank Dr. Watkins and we're welcoming her home because this was her home, her residency training home. And so the talk will be available. We'll have it uploaded so that people can review the slides if you want to. And we just want to say again, thank you so much, Dr. Watkins.